Breast cancer is one of the most common cancers affecting women worldwide. And yet, for many people, the diagnosis still feels deeply isolating. You may have heard the statistics before, but hearing them is very different from living through reality. Behind every number is a real person navigating fear, uncertainty, physical changes, emotional strain, and the challenge of continuing daily life while undergoing treatment. If you or someone you love is living with breast cancer, this video is here to offer understanding, clarity, and support grounded in science and compassion. Breast cancer is not just a medical condition. It affects the body, the mind, and the emotional well-being of a person, all at once. Modern medicine has made extraordinary progress in diagnosing and treating breast cancer, and survival rates continue to improve. But living with breast cancer means much more than receiving treatment. It means learning how to support mental health, manage physical side effects, and care for emotional well-being throughout the entire journey, from diagnosis to treatment and beyond. Breast cancer begins when cells in the breast grow in an uncontrolled way. These cells divide more rapidly than healthy cells and can form a tumor. Some tumors remain localized, while others can spread to nearby lymph nodes or other parts of the body. Breast cancer is not a single disease. There are multiple subtypes, including hormone receptor-positive cancers, HER2-positive cancers, and triple-negative breast cancer. Each type behaves differently and responds to different treatments, which is why care must always be personalized. Once a diagnosis is made, treatment may include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, or a combination of these approaches. These treatments are designed to remove or destroy cancer cells, but they can also affect healthy cells in the body. This is why side effects occur, and why physical and emotional support are just as important as medical treatment itself. Living with breast cancer often begins with shock. Many people describe the moment of diagnosis as surreal, as if time slows down. Even individuals who feel physically well may suddenly find themselves facing difficult decisions, unfamiliar medical language, and an uncertain future. This emotional response is normal. Fear, sadness, anger, confusion, and disbelief are all common reactions, and they do not mean that someone is weak or unprepared. They are a human response to a life-altering event. From a mental health perspective, breast cancer can place enormous strain on the brain and nervous system. Chronic stress activates the body's stress response, increasing levels of cortisol and adrenaline. Over time, this can contribute to anxiety, sleep disturbances, difficulty concentrating, and depressive symptoms. Studies consistently show that people living with cancer have a higher risk of anxiety and depression compared to the general population, particularly during active treatment. Addressing mental health is not optional. It is an essential part of comprehensive cancer care. Psychological support, counseling, and therapy can help individuals process emotions, manage fear, and regain a sense of control. Cognitive behavioral therapy, mindfulness-based stress reduction, and supportive counseling have all been shown to improve quality of life in breast cancer patients. These approaches do not replace medical treatment, but they work alongside it to support the whole person. Physical changes are often one of the most visible and challenging aspects of breast cancer. Surgery may alter the appearance of the breast or chest. Chemotherapy can cause fatigue, nausea, changes in appetite, and hair loss. Hormone therapy may lead to hot flashes, joint pain, and changes in mood. These effects can impact body image, self-esteem, and daily functioning. Fatigue is one of the most common symptoms reported by people undergoing breast cancer treatment. Cancer-related fatigue is different from normal tiredness. It is not always relieved by rest and can persist for months or even years after treatment ends. This fatigue is influenced by multiple factors, including inflammation, anemia, disrupted sleep, emotional stress, and the body's effort to repair itself. Gentle physical activity, when approved by a healthcare provider, has been shown to help reduce fatigue and improve strength. Activities such as walking, stretching, light yoga, or resistance exercises can support circulation, muscle health, and mood. Nutrition also plays a critical role. A balanced diet that provides adequate protein, vitamins, minerals, and calories supports the body's ability to heal and cope with treatment. There is no single cancer diet, but research consistently supports the benefits of whole, minimally processed foods. Vegetables, fruits, whole grains, lean proteins, and healthy fats provide essential nutrients and antioxidants that support overall health. Hydration is equally important, particularly during chemotherapy or radiation therapy. Any dietary changes should always be discussed with a qualified healthcare professional, especially during active treatment. Emotional support is just as vital as physical care. Breast cancer can affect relationships, family roles, and a person's sense of identity. Some individuals worry about being a burden to loved ones, while others feel pressure to appear strong, even when they are struggling. Emotional pain is not always visible, but it is real, and it deserves attention. Support groups, whether in person or online, offer a space to share experiences with others who truly understand what living with breast cancer feels like. Research shows that peer support can reduce feelings of isolation and improve emotional well-being. Talking openly about fears, hopes, and challenges can be deeply healing. Integrative oncology plays an increasingly important role in breast cancer care. Integrative oncology combines conventional cancer treatments with evidence-based supportive therapies designed to reduce symptoms and improve quality of life. These may include nutrition counseling, physical therapy, acupuncture, meditation, and mind-body practices. The goal is not to replace standard treatment, but to support the person as a whole. Mindfulness and relaxation techniques have been shown to help reduce stress, anxiety, and pain in people living with breast cancer. Practices such as guided breathing, meditation, and gentle visualization can calm the nervous system and promote a sense of safety and control. These practices are particularly helpful during periods of uncertainty, such as waiting for test results or adjusting to new treatments. Sleep disturbances are another common challenge. Anxiety, physical discomfort, hormonal changes, and treatment side effects can all interfere with sleep. Poor sleep can worsen fatigue, mood, and immune function. Establishing a consistent bedtime routine, reducing exposure to screens before sleep, and practicing relaxation techniques may help improve sleep quality. In some cases, medical support may be needed, and this should always be discussed with a healthcare provider. Living with breast cancer also means navigating life beyond treatment. For many people, the end of active treatment does not mean the end of emotional challenges. Fear of recurrence, ongoing side effects, and adjusting to a new normal are common experiences. Survivorship care focuses on monitoring health, managing long-term effects, and supporting emotional recovery. It is important to recognize that healing is not linear. Some days may feel hopeful and strong, while others may feel heavy and overwhelming. Both are valid. Giving yourself permission to rest, ask for help, and move at your own pace is not a sign of weakness. It is an act of self-care. Family members and caregivers also need support. Watching a loved one go through breast cancer can be emotionally exhausting, and caregivers often neglect their own well-being. Open communication, shared decision-making, and access to support resources can help both patients and caregivers cope more effectively. Science continues to advance rapidly in the field of breast cancer. Precision medicine, which uses genetic and molecular information to tailor treatment, is improving outcomes and reducing unnecessary side effects. Researchers are developing more targeted therapies that aim to attack cancer cells while sparing healthy tissue. These advances offer real hope and are changing the future of breast cancer care. Despite the challenges, many people living with breast cancer discover strengths they did not know they had. They learn to listen to their bodies, set boundaries, and prioritize what truly matters. While no one chooses this journey, support, knowledge, and compassionate care can make it more manageable. If you are living with breast cancer, you are not alone. Support exists, and your experiences, feelings, and questions matter. Healing is not just about treating the disease. It is about caring for the whole person, mentally, physically, and emotionally. If this video helped you understand breast cancer more clearly or made you feel supported, please consider subscribing to this channel. We share science-based, compassionate content designed to educate, empower, and support people living with cancer and those who care for them. Your subscription helps us continue creating meaningful, respectful, and informative videos for this community.